When you're beginning a natural supplement regimen or any regimen in general, you're trying to correct some deficiency, some problem that you have. You're trying to improve your joint health or address peripheral neuropathy or do all sorts of things. Obviously, we know lifestyle and diet modifications, they're big number one, as we always say here at When Wellness. But when you move to supplementation and many other things, remember this: less is more. When you're starting, less is more. If you have peripheral neuropathy, so you have damage to peripheral nerve or dysfunction of that nerve, maybe you have numbness and tingling, a common one we always talk about, carpal tunnel syndrome, where you get the numbness, tingling to the outside digits of the hand, maybe some muscle weakness. Regardless, what are the top supplements for that? Well, if we had a few to name, N-acetylcysteine, B vitamins, of course, everybody knows curcumin, omega-3s, alpha-lipoic acid, acetyl L-carnitine. Those are really the top 6 natural supplements when it comes to peripheral neuropathy, and that's not what this video is about. But if you had it, the principle is, would I take all 6 of those right away? I would take 1, maybe 2. If you have joint health issues, now we know top supplements are omega-3s, curcumin, undenatured type 2 collagen. You talk about green lip muscle, methylsulfonylmethane you could go for, right? We talk about a lot of different things. But when you're starting, definitely just take 1 and see if it has any substantial effects. See if it could help you first, right? Now, there is a caveat. If they're synergies, if they work well together, then you could try a few of them. And an exception to that rule or that principle in itself is evident when you talk about osteoarthritis, because we have, what are the top 3 supplements we really know of? We know of curcumin, standardized for 95% curcuminoids, of course, right? 1.5 grams in a day, divided over 3 doses, combined with something like piperine or a source of healthy fats. We have, to improve absorption, we have omega-3s, of course, and undenatured type 2 collagen. Why would I take all 3 of those at first? Because they actually improve one another. So this is totally different. It's, you're taking the curcumin, right? You're reducing inflammation in the gut. You're going to absorb other inflammation really ubiquitously throughout the body, and they're taken to relieve joint pain and reduce joint stiffness. But the average person takes curcumin, and it's good for your nerves, right? Reducing nerve inflammation as well is why we mention it when it comes to neuropathy. Average person's probably taking curcumin just for the anti-inflammatory properties, right? But, if you take it with the omega-3s, okay, we're reducing inflammation, we're improving the absorption of other things in the gut. Collagen, undenatured type 2 collagen, you always think of joints and skin and stuff like that. Well, that's actually reducing inflammation in the gut as well, improving the absorption of other things, including the curcumin, including the omega-3s. And guess what? The omega-3s, they're a healthy source of fat. So that improves the absorption of the curcumin. So they work in synergy. This is an exception, and it means we could take these 3 right off the bat. Now, they're also good. This is especially true if they're also good for many different things, not just one thing. We're not just talking about joint health here, trying to reduce joint stiffness, improve joint mobility in osteoarthritis patients, where exercise is really number 1, and things like, light strength training and Tai Chi and swimming and whatever, all that kind of stuff, right? Walking is great. But, they're enhancing the effects of one another, and they're good for a multitude of things. When you talk about omega-3s, they're great for your brain, they're great for your heart. We talk about them lowering blood pressure and LDL cholesterol and having all sorts of beneficial effects on brain function, right? DHA and EPA and their components of, cell membranes, and there's something that will help to increase the numbers of neurotransmitters, and those are brain chemicals that we use to communicate, right? And so it's good for brain health, good for your heart, good for your skin. Omega-3s are great for your skin, so is collagen. And so is reducing inflammation, guys. So if you're going to take more than one thing at once, you would better make sure of one thing: they act in synergy. You have to look into that for yourself, right? Because the majority of the time, if you're talking about trying to resolve something, you're only going to start with one thing. Now, when we talk about something like testosterone, we've done videos on testosterone, and we talk about DHEA, but we talk about first, males under 35 going for things like ashwagandha or fenugreek, making sure you don't have any nutritional deficiencies, a zinc, vitamin deficiency, right? Things like vitamin D and magnesium, you want to make sure you're not deficient in all those things, of course, first and foremost. So if you're taking something to reduce deficiency, sure, if you're deficient in zinc and vitamin D and magnesium, well then definitely get all three of those. That's fine to take them, right? But look at things that compete for absorption as well, right? Like zinc, iron, calcium, magnesium. Make sure you're not having over 800 milligrams of them all together at once. They'll compete for absorption, right? Things of that nature. So there's a lot to look into, but the whole principle here, without getting off tangent, it's a beautiful day, it's gorgeous, is start with just one thing, right? Less is more. And you know what? The same thing goes for sometimes more is more, right? You get more out of it. You put more hard work into something. Typically, if you do more reps with a heavier weight, you will grow more, right? Typically. But less is more when it comes to treatment too, starting with chiropractic treatment, for example. And the reason I want to do this video is today because I had a patient today where I said, look, we're dealing with these issues, in the neck and blah, blah, blah. And whatever their story was, I said, we're going to start slow. We're going to start with muscle work. We're going to start with opening up the space between those joints. And we're going to start with some basic, ART, active release, and some light adjustments after a comprehensive exam, of course, because they qualified for that on the first day, which is relatively rare, but they did. And see if we do that to one region, what happens here, or I'm not going to go in there and just attack everything in your body at once. And then we're not going to know really, what was doing the most for you, right? And that same thing goes for starting a supplement regimen. And that's really where this comes, because, I also had a question today. What are the supplements I should take, for my nerve health, or I should take, for this? And we mentioned a bunch of things for peripheral neuropathy before, right? But definitely just start with one or two that work well together. Good examples are things like omega-3s and curcumin, right? B vitamins are great with things that are also involved in energy metabolism, right? You see them in Super U because not only are they involved in things like blood cell formation, DNA formation, nerve health in general, they're involved in energy metabolism. All the B vitamins, they're cofactors or coenzymes in energy metabolism. So if you're going to do something or take something to increase the breakdown of, say, sugar for energy, or something that's going to give you more energy, well, you should also take things that are going to be cofactors in energy metabolism that support, meaning those pathways, and assist them. They are working in synergy. You can have them together. Otherwise, we're gonna start simple. All right, less is more. That's what we got for you guys. I hope you had a fantastic day. I hope you enjoy the view, baby, because I'm enjoying it. Look at here, I can see it. So that's pretty cool. I live in a great place. Erica, how you doing? Joel, what's up? Esplanada, I got to go to dinner with my mom. Ma, I love you. I'll be there really soon. Yeah. Brandon Malone, how you doing, man? Nate, Miguel, Ashley, what's up, girl? How you doing? What's going on? Dimitri, Craig, Das, Vegas, baby. I love Vegas. A great time. Master Dave, B. Some Niece, what's up, killer? How you doing? Radman Barry, Josh Winner. Not by coincidence, and Hotson's 89. What's up, Malcolm? How you doing? As for now, so we got for you folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have a great night. Thanks a lot. Remember, less is more, and happy one wellness. See you later.